The human body is a complex machine of many systems that must work together in order to maintain optimal health. When there's a system failure, symptoms arise, prompting us to seek the help of a physician. But a proper diagnosis requires more than just a chat with our doctor. In order to pinpoint where the breakdown has occurred and what can be done to fix it, the physician must take on the role of detective, often needing to look beyond blood pressure results and body temperatures. For physicians and other healthcare professionals, the best clues lie within us.
I would say that running the lab test is probably the best way to treat a patient. Often patients may say, I feel this way or that way, but to actually help the physician treat the patient, they need to know what their basic lab values are in order to take that next step in diagnosing what's wrong with their patients.
The results of lab tests creates a roadmap of our health status and can give doctors the information needed to successfully treat the symptoms a patient may be experiencing. In fact, these tests can outperform and are more cost-effective than other diagnostic instruments such as MRIs and CAT scans. The ideal scenario is to combine results from all areas in an effort to acquire as much health information as possible.
I think it's important to remember that a laboratory test is a tool, not a diagnosis. Having an abnormal laboratory test doesn't always mean you have a disease. Laboratory tests don't directly detect diseases. They detect markers that are associated with diseases. That's why it's so important to discuss laboratory results with your doctor.
Laboratory testing is essential to all of our diagnostic and treatment decisions that we make in the management of cancer patients. We don't treat patients without a diagnosis, and oftentimes the information that we get from laboratory testing helps us understand the diagnosis so well that we can customize or optimize the treatment recommendations, honing in on appropriate chemotherapies that are best tailored for the individual patient and that patient's tumor type.
Beyond diagnosing prominent symptoms, laboratory tests can help a patient understand what their risk is of facing certain health issues, becoming a preventative measure against potentially life-threatening conditions.
Everyone is familiar with cholesterol testing and watching what they eat if they have high cholesterol. In the laboratory, we can determine the HDL cholesterol level, which is the good cholesterol, and the LDL level, which is the bad cholesterol. If you have too much bad cholesterol, even after being on a low cholesterol diet, you may need to take medication to prevent heart disease. Starting a medication after a lab test is much better than starting a medication after a heart attack.
I think it's very important for a patient to be actively involved in their health care and not just a passive participant. I think that's especially true in this country because our healthcare systems are so complex and confusing. You need to understand what's happening to you. Why are these tests being ordered? What do they mean? And make sure that the physician is answering those questions for you. I think in general that'll improve the quality of your health care, but it also improves the quality of the healthcare system as a whole.
Without the modern tools and the evolving tools that we have, we would be practicing in the dark.
The patient may not meet us, but we are their medical detectives, looking for disease clues in test tubes and specimen cups.
The American Society for Clinical Laboratory Science is the leader in promoting the value of medical laboratory testing to everyone from healthcare professionals to the general public. ASCLS provides leadership, education, and management to medical laboratory professionals, ensuring excellent, accessible, and cost-effective laboratory services for the consumers of healthcare.
I think one of the things that's unique about ASCLS is that it's the one professional organization that truly represents the entire profession, not just one specialty or another. They all need tools. They all need ongoing continuing education and development, which is one of the big strengths of ASCLS. We provide education in their backyard, in their local state areas. They can get education at a regional level. They can get education and training at a national level. We also provide advocacy tools. Our professionals need to be able to advocate for their profession, for the value of lab testing, and for the patient. ASCLS over the last 3 to 4 years has focused heavily on patient safety. And some of the best things that we have done are to give tools to our people, practical tools that they can use with the patient to document their lab testing, practical tools that they can use in the workplace to explain what lab tests mean to patients and other healthcare workers so that laboratory isn't this big black box that nobody understands. There's a lot of value in laboratory testing, and we can help the patient and other healthcare workers use it to its maximum.
As doctors and patients better understand the value and importance of laboratory testing, the demand for lab professionals is growing, creating jobs in this dynamic and essential field.
Healthcare reform, for example, is going to add about 47 million new patients into the healthcare system that'll now have coverage. That'll mean patients that are going to clinics, going to hospitals, and therefore needing lab testing. So lab testing volume will increase for that reason alone. Secondly, our profession, like many other professions in this country, is aging, and we have a high percentage of people who over the next 10 to 15 years are going to be retiring. So we need to work really hard at expanding programs that we have right now at universities and colleges, but also creating new programs so that we can get more people into the pipeline to become laboratory professionals to provide health care for us.
Every day when I come to work, it's not the same thing. There's always different aspects. There's always issues to troubleshoot. It's not about just reporting out a basic hemoglobin or a chemistry result. There's a lot of thought that goes into it. Not every patient is easy. They have other underlying conditions that can affect their lab results, so it isn't always as easy as just running the sample and reporting out the results. We often get calls from physicians asking, we have this lab test, is this possible with this patient's condition? And sometimes they even come down and look at different cells with us. So it's quite interesting, and you do feel important when they come down and want to work with you and they actually rely on you for what you're seeing to help them diagnose their patients.
As specialists in laboratory medicine, it's our job to stay up to date on the newest tests and the best tests. We work with laboratory technologists, technicians, and other laboratory specialists who are the educated and highly trained professionals who perform these tests. Together, we work to make sure that the tests we perform are accurate and reliable so physicians and patients can trust our results.
The ASCLS provides a voice by educating and advocating all laboratory professionals and the role they play with all healthcare professionals. Value, ensuring cost-effective laboratory services without compromising service and quality. Vision, working towards the day that everyone has access to accurate and high-quality laboratory results, contributing to longer, healthier lives. For more information on the importance of high-quality clinical laboratory services, log on to ascls.org.